Russia's EnteroMix cancer vaccine is making headlines for 100 efficacy in early trials. But experts caution that these are preliminary results from phase 1 studies. Here's what we know so far about EnteroMix, its promise, and why larger trials are crucial before real-world use. Cancer continues to be one of the world's most feared diseases, often associated with uncertainty and long, difficult treatments. But scientists in Russia have sparked global curiosity with news of an experimental vaccine called EnteroMix, which is being described as a potential game-changer. In fact, it is being celebrated for allegedly being 100 efficient. Unlike traditional treatments such as chemotherapy or radiation, EnteroMix uses a unique approach. It combines 4 harmless viruses, re-engineered to hunt down cancer cells and train the body's own immune system to fight back. Early reports suggest promising results, but it is important to remember that EnteroMix is still in the very first stage of human trials, with a long road ahead before it could ever reach patients. Also Russia claims it developed first cancer vaccine in big breakthrough, says will distribute for free in mid-2025. Russian officials and local outlets reported that EnteroMix had moved from preclinical studies into a phase 1 clinical trial and that preliminary results from early work mostly in animals and early human testing looked promising. The underlying facts are more restrained. The phase 1 trial is small, open-label, and primarily assessing safety and tolerability, not definitive proof of cure. Also Maharashtra government to provide free cancer vaccine for girls aged 0-14 across state. According to trial announcements, the phase 1 study has recruited around 48 volunteers and reported very low toxicity to date. Preclinical work reportedly showed effects ranging from slowed tumor growth to complete tumor regression in some animal models. But these are early results. Phase 1 trials are primarily designed to evaluate safety, dose ranges, and side effects, not to establish broad efficacy across cancers or patient populations. More extensive phase III trials with larger, controlled groups are required to demonstrate whether a therapy truly works in people. Viral-based and personalized cancer vaccines are an active, global area of research. Some oncolytic virus therapies, for example, talimogene laherparepvectivc for melanoma, have regulatory approval in specific settings, and other vaccine strategies including mRNA-based and peptide vaccines are advancing in clinical trials worldwide. Positive signs in early trials are encouraging, but history shows many promising early results fail to translate into later-stage success without rigorous testing. EnteroMix is an intriguing example of oncolytic virus and vaccine-style cancer research, and Russia's trial news is worth watching. But phase 1 safety data and preclinical results do not equal proven cures. The responsible message for patients and the public is this: promising early science needs larger, controlled trials and independent peer review before it can be called a breakthrough treatment. Disclaimer: tips and suggestions mentioned in the article are for general information purposes only and should not be construed as professional medical advice. Always consult your doctor or a dietitian before starting any fitness program or making any cha.